Bismillahirrahmanirrahim. Assalamu alaikum. Welcome into my YouTube channel Insight. We are discussing the unseen flaws in our healthcare system. Today is the fifth and last episode of our vlog series on this topic. Every day, lives are lost due to preventable medical errors in Pakistan. But here is the real question. How many of these errors are ever acknowledged, let alone fixed? From misdiagnoses to overprescription and unsafe procedures, medical mistakes are a silent crisis in our healthcare system. Yet, we rarely talk about solutions. Dr. Marty Makary's blind spots uncovers how systemic flaws, lack of transparency, and financial incentives lead to dangerous errors in healthcare. But these are not just Western problems. They are happening right here in Pakistan as well. In this vlog, we shall explore how these issues impact our healthcare system, and more importantly, how we as doctors, policymakers, and patients can work towards solutions. Dear viewers, we are in the last episode of our series on Insight on the book of Blind Spots by Dr. Makary. Today, we shall discuss the implementation strategies for applying blind spots findings in Pakistan's healthcare system. The first strategy or the point is reforming medical guidelines and practices. In my opinion, the challenges are outdated treatment protocols and lack of evidence-based guidelines here in Pakistan, and slow adaptation to new medical research by medical community here. So, what strategies we need to adopt to improve the medical guidelines and practices here in Pakistan? I think we should strengthen the regulatory authorities like DRAP and PMDC. The regularly update national medical guidelines to reflect global best practices. So, it should be the requirement that the national medical guidelines should be there and they should be regularly updated. Then mandatory evidence-based training. And this requires hospitals and clinics to conduct workshops for doctors on the latest treatment protocols. So these should be the minimal requirement, that the guidelines should be laid down and adopted and followed. And second, that there should be mandatory evidence-based trainings. The PMDC in the recent few years, they floated and they required the CME hours for the renewal of their registration and for keeping their name inactive. But now, unfortunately, that is not the anymore required. So I think we need to adopt the policy that the evidence-based training is mandatory, and the national medical guidelines, they are mandatory as well. Then we should introduce peer review systems. We should encourage hospitals to review treatment plans to reduce errors and unnecessary procedures. So for the first point, that is the reforming medical guidelines and practices, three types of strategies are important. Strengthen the DRAPE and PMDC regulations. There should be mandatory evidence-based training. And number three, we should introduce peer review systems by the institution. The second point which I will stress upon is combating overuse and misuse of medication. The challenges in this domain is that we see the overprescription of antibiotics and painkillers here in Pakistan, and the PPIs, proton pump inhibitors, of course, and there is self-medication culture among patients. Patients take these drugs without any prescription, and these drugs are available to them without any doctor's prescription. And there's poor enforcement of pharmacy regulations in our country. So, what strategies should be adopted to combat these? In my opinion, first is strict prescription monitoring. We should implement electronic prescription tracking to flag excessive antibiotics use. Then public awareness campaigns. We need to educate patients via TV, social media, and local health workers about the risks of antibiotic misuse and other drugs misuse. And the third, we should regulate pharmacies more strictly. We should introduce fines for pharmacies selling prescription drugs without a doctor's prescription. Now we need to adopt this national strategy, national policy of strict prescription monitoring, public awareness campaigns, and to regulate pharmacies more strictly if they provide drugs, especially the sensitive drugs, without prescription. The third is addressing medical dogma and outdated practices. The challenges under this domain are, in my opinion, here in Pakistan, doctors practicing outdated treatments. Second, resistance to new medical knowledge. So these are the two important challenges here. And how to overcome, what strategies we should adopt? In my opinion, continuing medical education reforms. We should make regular refresher courses mandatory for medical license renewal. As I said, this was a policy a couple of years ago, and this policy was adopted for 2 to 3 years, and then it was just left. Then incentives for updated practices. We should provide grants and career incentives to doctors adopting evidence-based treatments. And of course, international collaboration. We should establish partnership with global health institutions for knowledge and exchange programs. The fourth is reducing unnecessary medical procedures. The challenges here are unnecessary C-sections and diagnostic tests for financial gain, patients being misled into expensive procedures, and the strategies to overcome this is mandatory procedure audits, which require hospitals to justify high C-section and test rates through government audits. Second, patient second opinion systems. We should launch online or telehealth platforms for patients to consult independent specialists before undergoing major procedures. And third, financial penalties for overuse. We should impose financial consequences on hospitals found guilty of excess procedures. Next is strengthening patient-centered care and awareness. The challenges here are patients are unaware of their rights. There's a lack of access to alternative medical opinions. And in my opinion, the strategies we need to adopt is public health literary campaigns. We should create a government run awareness programs about patient rights and healthcare choices. Then telemedicine expansion. We should use telemedicines to provide second opinion, especially in rural areas where healthcare options are limited. And third, community health ambassadors. Train local volunteers to educate people about common medical conceptions. So, in my opinion, these three are the strategies required to strengthen patient care, centered care, and awareness here in Pakistan. The sixth is reforming bureaucracy and medical accountability. The challenges here, which I see, are corruption and inefficiency in healthcare administration, then lack of oversight on hospitals and private clinics. And the strategies which needs to be adopted, in my opinion, are independent healthcare watchdogs. We need to establish a third-party monitoring system to oversee public and private hospitals. And of course, we should try to avoid the corruption aspect. Here, there is one aspect of corruption is possibility, so we need to strictly regulate that. Then digital health records. We should implement a national electronic medical record system to track treatments and prescriptions. And of course, the public complaint portals, these are very important. Set up an online system where patients can report medical malpractice directly to authorities. Very important point is that before going to these steps, we need to educate patients. The patient needs health education. The patient needs understanding of the issues of their health, because what the patient expect from doctors is not based on reality. It's based on their wishes, and most of the times what they expect, it's not possible, or it is wrong wishes. So this is very, very important that before embarking on these strategies, we need to create mass public awareness in our country. Otherwise, these systems will definitely fail. Then the next is the tackling the cost and accountability of healthcare. The challenges here are the expensive private healthcare system and poor quality public healthcare. So it's contrast. In the public healthcare system, the quality is not to the mark. And in the private healthcare system, quality is there, but it's very, very expensive. So we need to work on both. And of course, rural populations lack access to specialists. And this is very important, and we need to take the help of the modern technology like telemedicine. We should expand the health insurance schemes. And this will strengthen and expand the services, like the Sehat Sahulat program is there, and it has helped a lot, and it has improved the healthcare, and it has covered more citizens. I appreciate that. Then we should upgrade primary healthcare centers. We should invest in improving rural clinics to reduce the burden on the urban hospitals. We see that very minor problems, the patients comes to the tertiary care hospitals, and the tertiary care hospitals are busy in managing those very minor ailments, minor issues, and thus the time required for the major or the required problems, it is used by those the unnecessary referrals. And of course, we need to subsidize essential medicines. The government needs to negotiate lower drug prices and ensure availability in all regions in the country. So, dear colleagues, in conclusion, I must say, by implementing these strategies, Pakistan can modernize its healthcare system, reduce unnecessary treatments, and ensure patients' safety. The key to success lies in strong governance, public engagement, and leveraging technology. So it's a triangle. On one side, it's the strong governance, then the public engagement, and then the leveraging technology. Until and unless we develop this triangle, we take care of this triangle, we improve this triangle, all the three components, we will be facing all these issues. And when a country like United States are having such issues, then what about Pakistan? What to say about Pakistan? Here, these issues are many fold. But if we try to recognize, identify where the main problem is, and I try to share with you, in my opinion, the 7 main areas where our healthcare system needs really a major change. And then we adopt the strategies which I shared with you, then hopefully we will be having a good change in our healthcare system. So thank you very much for being with me during the whole series of the discussion of our healthcare issues. I hope I was able to highlight the main issues in the light of the book which has been published by Dr. Makary, The Blind Spots, and it is an eye-opening not for the developed countries but for the developing countries as well. Inshallah, we shall meet in another series on some other important topics. Till then, take care. Khuda Hafiz.